Hi, everybody. Happy Friday. I'm going to pause. I know I owe you a second video from last week, the second part to that, and it is coming, I promise. But I wanted to take a quick moment to pause and talk to you guys about autoimmune conditions and autoimmune disease, and a specific diet called the Autoimmune Protocol Diet, the AIP diet, that can be maybe beneficial in managing the symptoms of autoimmunity. My private practice has kind of inadvertently, but kind of sort of strategically too, started to hone in on patients that have diagnosed autoimmune conditions. So this is a topic near and dear to my heart. And so with that said, let's chat about it. In order to understand what an autoimmune disease is and how it affects our body, we must first understand what the immune system is and how it affects our body. So I'm sure you're not new to what our immune system is. We've been talking a lot about it during COVID season and flu season and all that kind of thing. But our immune system is our internal defense mechanism. It is it comprises a variety of different parts of our body, including the white blood cells and our gut and our antibodies and thymus and all sorts of different parts of our body play a role in keeping us healthy. But the whole point of our immune system is that when a foreign invader like a bacteria or fungus or virus, for instance, come into our body that shouldn't be there and has the potential to make us sick, it will go in, prompt all of our immune responders to go in and fight that foreign invader. In the case of autoimmune patients and in the case of autoimmune disease, our body will mistake our healthy cells for foreign invaders, and they will go attack our otherwise healthy and functioning cells. And this can be due to a variety of different things. There are over 80 identifiable autoimmune diseases that we know of, although I think we're inching closer to about 100 now. And this is a rising issue, especially over the past 2 decades. And we think that environmental factors, exposure to chemicals and environmental toxins, smoking, as well as dietary related factors, that all of these things increase the inflammatory load of our internal system. All of these play a role in the development of autoimmune disease. And we have about 24 million Americans alone that have a diagnosed autoimmune condition. But the thing with autoimmune disease is that a lot of the early onset symptomology is very similar to, everyday stressors or common cold. I have patients that come in with extreme fatigue or, IBS or leaky gut related issues, which I talk about a lot. Or they might have joint pain or muscle aches, or maybe even on and off again fever that they can't identify. So these are very common symptoms that can be hard to place, and a lot of people go misdiagnosed for a long period of time. So autoimmune conditions are on the rise, and they've been on the rise for some time now, and it's not always genetic. In fact, I would say most often it is not genetic. To give you an example of some genetic autoimmune conditions, which even though these do have more of a genetic component, you can still develop these autoimmune diseases without having any familial history of it. But we do see it in type 1 diabetics. Type 1 diabetes is a condition that affects our pancreas, and our pancreas is the digestive organ that actually produces insulin, and insulin is what is required to utilize glucose in our blood. We do see genes playing a role in that condition, although there are lots of people who have developed that condition that don't have a family history. We also see a strong genetic tie to people who are diagnosed with lupus. And lupus is one of those autoimmune diseases that can affect a variety of organ systems and body parts, including your joints and your skin. There is a genetic component tied to that. And in fact, African Americans and Hispanics are more than twice as likely to develop lupus than white people. So genes do play a role, but they are not the be-all end-all for yes, you will, yes, no, you won't develop an autoimmune condition. In fact, there are a lot of potential predetermining factors, including sex. Females are 3/4 more likely than males to develop any autoimmune disease. Age also plays a role in the potentiality to develop an autoimmune condition. The most condensed age group that we see the first onset of autoimmune disease is between the ages of 15 and 44. That doesn't exclude older or younger people from developing autoimmune disease earlier or later in life, but the biggest amount of people is between that age group. Autoimmune disease is considered a chronic health condition. There are currently no cures for autoimmune diseases. But that does not mean that if you have an autoimmune disease or if you suspect that you have an autoimmune disease, that you cannot still live a very long, healthy, active life. That is possible, and diet and lifestyle are two very critical components to managing the symptoms of autoimmune disease, which is really when you have an autoimmune condition, that's what you're focused on, is managing those symptoms. So for the purposes of the rest of this video, I'm going to talk about one specific elimination diet called the Autoimmune Protocol Diet, otherwise known as the AIP diet. Fairly new, and I'm sure you guys, if you've been watching my videos, you know I talk a lot about elimination diets. This one is specific for reducing inflammation in the body, which as we've talked about already, for autoimmune patients, we not only want to reduce the inflammatory load inside of their bodies, but also to not prompt our immune system to act even more than it already is. So let's talk about the AIP diet. The AIP diet, it has strong foundations in the paleo diet. So if you already know and are well versed in the paleo diet, you have a leg up with the AIP diet. If you don't know what the paleo diet is, please go ahead and watch my paleo versus keto video from back in May. That will help give you a good overview of what it is and give you a good foundation for what I'm talking about now. The AIP diet, though, does go one step further. There's a lot more restrictions in the elimination component of the AIP diet, which will take several weeks to really reduce the inflammatory load. But much like the paleo diet, things like grains and legumes and dairy are all going to be eliminated. You will also be eliminating eggs and certain types of chocolate and alcohol. I have a full list of the do's and don'ts of the AIP diet on my blog, so I don't want to, inundate your video right now with all of that. So just go to my blog and look at those. But the point of the AIP diet is that you will eliminate all of these foods for a certain amount of time, usually about 4 to 6 weeks, depending on your condition, depending on your inflammatory load. And then systematically and incrementally over time, you will reintroduce those foods. So I've talked about food elimination diets before. The AIP diet is specifically for autoimmune conditions because it is focusing on reducing that inflammation and also not prompting our body to overstimulate our immune system that is already overstimulated. So this is a very specific elimination diet just for autoimmune conditions. And once we get to that reintroduction stage, you will take a few days to reintroduce one food at a time. That way we can really tell whether or not which foods are affecting your body, which ones are contributing to your toxic load. There very well might be some foods as we go along this elimination diet and reintroducing foods that we find you can't have anymore. Dairy, for me, for instance, I can't have it anymore. So there might be some sad developments that come of the AIP diet or any food elimination diet for that matter. But the goal is that ideally we will figure out what your exact triggers are that is contributing to your toxic load and toxic burden inside your body and be able to balance it out. And that's why working with a registered dietitian or another healthcare practitioner that's well versed in this particular remedy for managing autoimmune conditions is because this is very personalized. We're not telling you to follow the AIP diet forever. It is a short, very strict period of time. And then from there, it is all about recalibrating and figuring out a systematic approach to figuring out your specific body type and what is causing your specific inflammation. And also the whole point of AIP2, the nice side effect of AIP2 is that it's helping to heal your gut. And your gut, leaky gut especially, leaky gut is a condition in which there are actually holes inside of our gut that cause a variety of problems. Healing your gut is one of the biggest things, one of the biggest outside of your diet that you can do for managing your autoimmune conditions. And this, I've said a million times, is not something that is just a one size fits all either. A gut protocol that works for one person might not be the right protocol for you. So you have to highly, highly, highly recommend, before jumping into any sort of probiotics or any sort of gut protocol, please contact me. Please contact another registered dietitian who is familiar with these autoimmune diseases and gut health before you do that, because there are a variety of different nuances and it's important to be monitored. So last but not least, if you have an autoimmune condition, if you have an autoimmune disease, and you're not sure what to do about it, or if you know somebody that does, please reach out to me. There are a lot of ways that we can take active steps every single day with our diet, with our lifestyle, including stress management and things like that, to help our inflammatory load and manage your symptoms. Because you will have an autoimmunity for, as far as we understand now, you'll have it for probably the rest of your life, but that does not mean it needs to slow you down. You can control it, you can manage it. I am here for you. So please contact me. Let's get to the bottom of it. Let's get you feeling good again.